Hello, my name is Dr. Dwarakanath. I'm a gastroenterologist here in the Trust at North Tees. I'm here to talk to you about colonic dilatation. Why do we perform colonic dilatation? We do this in two main cases: when there is narrowing in the large bowel, the colon, or at the end of the small bowel, which is called the terminal ileum. The main reasons behind this are inflammatory strictures caused by Crohn's disease or bowel ischemia, or at sites of previous surgery. Prior to the procedure, you will see one of our pre-assessment nurses to go through the procedure in detail with you. You will receive an information leaflet with diagrams that will explain the procedure and any risks associated with it. You will also have some blood tests to ensure that the procedure is done safely and with a minimal complication rate. What is colonic dilatation? Prior to the procedure, you will have had a CT scan or an MRI scan to delineate the stricture and show the position of this to the endoscopist. The endoscope is then passed into the rectum and to the level of the stricture. Thereafter, a balloon is used to open up the narrowing in the bowel. During this time, you will have had sedation and some pain relief to ensure that this is as comfortable as possible. X-rays are used during the procedure to ensure that the procedure is done safely and with a minimal complication risk. On the day of the procedure, you will be greeted at the endoscopy reception area. You will meet one of our admitting nurses. They will ask you some simple basic questions about your general health. You have also been asked to fast for 6 hours prior to the procedure. The doctor who will do the procedure will go through your consent with you to explain the benefits of having this procedure done, as well as the small risks that occur with any endoscopic procedure. You will then wait in the waiting room prior to entering the endoscopy room. Like any endoscopic procedure, colonic dilatation does carry risks. These risks are small and are far outweighed by the benefits of the procedure. The main risks are bleeding, perforation, restenosis, that means re-narrowing of the area, also the adverse effects of sedation. Should a complication occur, and these do occasionally occur, you may require surgery to repair any perforation or bleeding. These risks are very, very small. One of the other issues that can occur with colonic dilatation is that the stricture reforms and the patient requires further dilatations in the future. The procedure itself, you'll be taken into the endoscopy room. You'll be greeted by the endoscopy team. We will give you some sedation and pain relief to make the procedure as comfortable as possible. The procedure overall takes about 30 minutes. We use X-rays to position the balloon in the safest possible way to perform the dilatation. After the procedure is performed, you recover in the recovery area for a few hours. You're given something to eat and drink, and then when safe, you're allowed home. You may well be given some laxatives to take to ensure that your bowel habit is regular afterwards. Should there be any further abdominal pain that concerns you, please contact the endoscopy department, or if it's out of hours, please contact the A&E